Hey guys, welcome to Tuesday Talks with the Green Bay Doulas. I'm Emily Jacobson. So, September is Newborn Screening Awareness Month. What is that? So, let's talk about it. So, there's nearly 4 million babies that are born in the United States, and many of them are very healthy. But there are some babies who look normal on the outside, per se, that have some issues happening inside that we may not know about. And so a newborn screening really helps to identify these quicker so that those families can get the support that they need right away. So the first thing that they do is a blood test. Usually they'll prick the infant's heel and put 5 different samples of blood on a piece of paper. And that is used to help identify any blood disorders or PKU, which is a state mandated test. And those, no news is good news. So your baby will go through a blood test. Then another thing that they'll do is a hearing screen, and that's usually done around 24 hours. And it's usually done in the evening when baby's really sleepy. It gives parents a couple extra minutes to really get some sleep while they go and do this. And what they're doing with the hearing test is 2 things. They are seeing how your baby's ears respond to sound to see if there's any hearing loss. They also are doing an auditory brainstem response, and that is part of the nerve that carries ear to sound from the ear to the brain. So they put like little mini earphones on the baby, and there's like these little Band-Aid electrodes that are placed on the baby's head to detect the brain's response to when sounds are played through those those headphones. And so usually that test only takes about 5 to 10 minutes. Sometimes babies are very squirmy and very wide awake, and it can take a little bit longer sometimes. So just be aware that that's what's happening when they do a hearing test. And then the third part, they do a pulse test, pulse oximetry. So the pulse ox, which is like that little clip that goes on your finger. And that is a non-invasive test, and it just measures the amount of oxygen that's in your baby's blood. They can help identify different heart disorders with that, and it is very painless, and they'll do that right before they leave. And I think one of the questions people also have is, are all babies screened at birth? And they are. Whether you're doing a home birth or a hospital birth, they all have their own newborn screening standards that they do, and they can really help with conditions to be identified right away at birth and treated early, so your baby can grow up to be healthy with normal development. And you don't have to ask for it. It is standard within the hospital system. And, usually the blood test, like I said, is generally performed between 24 to 48 hours old. That may be changing right now, and they might be doing it sooner due to trying to get you out of the hospital quicker. Some states require a second test at 2 weeks old, but that's pretty rare as far as what we know as doulas. And like we said, no news is good news. And so that's generally what happens. How much does it cost is another question. It's covered by your insurance. It is part of the experience of a hospital birth and part of the protocols that go with it. And so you can always contact your state coordinator and ask those questions as well. But I just wanted to bring awareness to that. I think a lot of people just say, oh yeah, we have to go do the newborn screening. And people are like, what's that? Sometimes they'll also listen to the baby's heart for a little bit. They might do a bilirubin light as well, which is like it looks like a thermometer, a handheld thermometer. It just goes boop and touches the baby's forehead, and that can tell what the bilirubin levels are, and if your baby is at risk for jaundice, or if they're becoming more jaundice. That's a great way for them to be able to figure that out, is with that bilirubin test. So generally when you have your baby and they go to the nursery to do these tests, it will generally only be about 20 to 30 minutes that they're gone. So just so you know, that's our Tuesday Talks, and September is Newborn Screening Awareness Month. Have a good one, guys. Bye.